Welcome. I'm Jill Binkley. I'm Program Director and founder of Turning Point Breast Cancer Rehabilitation based in Atlanta, Georgia. Turning Point is a nonprofit 501c3 healthcare organization with the mission to provide evidence-based survivorship support care for women and men going through breast cancer. At the same time, we strive every day to reduce disparity in care and increase access to care by reducing barriers such as geography, culture, and race. Welcome to our series, Issues in Breast Cancer Survivorship. This is a four-part series related to decreasing and enacting change in racial disparities in breast cancer survivorship. Our first forum, held in October, dealt with some of the issues surrounding and causes of racial disparity in breast cancer survivorship. We are excited tonight to move on and discuss enacting change and how we can work together to enact change in this disparity in cancer survivorship. Next slide. I'm very excited tonight to introduce my friend and colleague, Dr. Lisa Van Hoos. Dr. Van Hoos is Associate Professor and Program Director in the Physical Therapy Program at the University of Louisiana, Monroe. She is a board-certified clinical specialist in oncological physical therapy. Dr. Van Hoos is known internationally for her contributions to and excellence in the realms of oncologic physical therapy, research, education, and equitable access to healthcare. Welcome, Lisa. Next slide. Lisa and I want to begin by just reviewing together some of the concepts that we discussed in the first forum in October, just to provide a framework for tonight's conversation about community solutions. There's a significant gap between the medical and surgical treatment of breast cancer and support for the myriad of physical and psychosocial issues. We established that, I believe, in our October session. Evidence supports the critical role of exercise, rehabilitation, emotional and nutritional support to maximize quality of life during and after breast cancer treatment. Turning Point has been advocating for equal access to care and standard referral and navigation to support services for almost 2 decades. So while we've established that all breast cancer survivors have a gap in this care, we also know that Black women have an increase, that gap is increased between the medical and surgical treatment and survivorship care during and after their treatment for breast cancer. We know that Black breast cancer survivors have more significant survivorship issues and a larger burden of illness. With the difference in this burden of illness, medical and rehab providers must be proactive and seeking these communities out. We also know that less than 50% of minority cancer survivors are receiving care that's in accordance with NCCN guidelines. Next slide. Key contributing factors include racism in general and healthcare specifically. In cancer care, a recent survey led by the NCCN Coalition Network found that 6 out of 10 oncologists agree with the following premise. Non-white cancer patients are more likely to receive poor quality care than white cancer patients. This is oncologists in the United States themselves acknowledging that there is this gap. Redlining, or discrimination against residents of certain areas or neighborhoods based on race or ethnicity, applies to both financial services, but also to healthcare services. Neighborhood disadvantage is an important predictor of poorer cancer survivorship outcomes. Next slide. Obviously, the Black community is not monolithic. However, there's a shared experience that I myself have heard as I've listened closely to my patients over the last 20 years. Hundreds of patients have shared their stories with me. And in my opinion and my experience, women of color experience racial discrimination related to their treatment and diagnosis, have inequitable access to support care, and are unheard by their healthcare providers more commonly than their white counterparts. Other shared observations from the first forum include a general hesitancy to talk about cancer within the community that reduces available support systems. The support systems aren't aware of what's going on with the patient. Breast cancer impacts the family as a whole, and anxiety and distress in both the patient and their family and surrounding community are significant. Black women in particular may choose to navigate the journey without this supportive care, put their family first, and potentially sacrifice their own care in order to meet families' priorities. All of these issues combined have a downstream effect that increases disease burden while decreasing access to important supportive care. Lisa, I'm going to turn it over to you.
Thank you so much, Jill. Thank you for starting the intro. And we'll move on to the next slide. And so to continue that conversation, some of the other things that we talked about in the webinar was the financial toxicity associated with cancer and its treatment. It continues to be the #1 cause of medical bankruptcy in the United States. And then we do know from the research, from the data, that survivors who self-identify as Black are more likely to have financial barriers. Now, I do want to make it clear that we're not saying it is because of their Blackness. We are saying that it's related to the racism associated with their Blackness and the historical, structural, systemic factors associated with being Black in the United States. We also know that there are some systemic issues related to having a lower household income and also living in poverty that plays a direct role in health outcomes related to cancer survivorship. And then I love this conversation around decreased opportunities related to casual or recreational knowledge transfer. So when you think about that, like if you were at your child's basketball game, or let's say you were, at the grocery store or at a community center, many of us may live in neighborhoods where it's very likely that we're going to be talking and sitting next to a nurse or a physician or a therapist, right? A social worker, a counselor. But there are communities where those persons aren't represented. And so then because of that, there's this loss of this, what's known as a casual knowledge transfer about such things as where would one seek care? What are the resources available? And so we have to recognize that there is some privilege associated with the zip code in which you live and the zip code in which you work. And the data has already strongly supported that. On to the next slide. And so then because of that, we recognize that there is a need for a necessary systems change because we cannot address a societal issue, a population health issue with just individual interventions. Those individual interventions are only going to get us to health promotion. They're not going to get us to changes in population or community health. And so we talked a lot about the need for social justice. We talked a lot about the need for healthcare to be equitable. We talked about the need for cancer navigation, and that's going to be part of the conversation tonight. And we're looking forward to your thoughts on those things. There is a social obligation for organizations that provide care to persons with cancer and their caregiving units to collaborate. If we're really going to provide individual care, then we've got to be able to do that from a collective responsibility, and also being open to telerehabilitation and other innovative models that may improve access for all. And the next slide. And so then we also had a conversation about the need for similarity, affinity between the healthcare provider and the patient. And some people use the term therapeutic alliance. And there is some pushback on this conversation, and we will recognize that, where people are like, so are you saying that a Black cancer survivor should only seek care from a Black provider? No, what we're saying is but they should have the choice if they so choose. It's no different than if you are someone that loves to run, or if you're someone that, you know, has a particular faith or even sex. Often you're able to choose a provider who has some similar characteristics to as you do. And so then we're just saying that clients should be able to have that choice in their selection of providers. So diversification of workforce is needed. And then ultimately, we want you to remember to see the patient in front of you. So some of the quotes from the last webinar was treating the person as an individual is the single most important thing on reducing disparities. And then the next quote is recognize the doctor in front of you. The fact of that, yes, you may be a doctor of nursing, of PT, of OT, of medicine, but that person is the doctor of their lived experience. So in essence, you really are two peers having a conversation, and respect that and value that. And also making sure that we're screening for things such as the social determinants of health and distress. And so one of the recommendations was using the distress thermometer at a higher frequency or another tool to really make sure that we're allowing people to kind of speak truth to whatever their lived experience is. So as you can see, we had a hearty conversation that last webinar, and we're looking forward to having just as much conversation today. And that's really what we're hoping this will be, as a discussion. So I'm going to start bringing in our panelists, and you are in for an amazing treat tonight. And so the first person we're going to ask to show their video is going to be Preska Collins. Preska, can you come on and introduce yourself?
Good evening, everyone. My name is Preska Collins, and I am an associate professor of physical therapy at Florida Southern College. And also I am the director of community engagement in our School of Physical Therapy.
Awesome. And we're so excited to have you and your perspective and to be able to talk about your work. Jamie Dorsey, can you show your video and introduce yourself?
Yes, good evening, everyone. My name is Jamie Dorsey. I'm the CEO of the Center for Black Women's Wellness in Atlanta, Georgia. We're a community-based nonprofit organization committed to improving the health and well-being of underserved Black women and their families.
Awesome. And we're so excited to hear about all the good work y'all have been doing. And then Consuelo, can you show us? And there she is. I knew you would come on the scene with just gorgeousness. So yes, we are so excited to have you share time and space with us, and introduce yourself.
Hi, good evening, everyone, and thank you for having us. My name is Consuelo Ross, and I am the president and founder of Surviving the Odds. We are a community nonprofit organization based out of Kansas City, Missouri, and our focus is on breast cancer and breast health in women of color, and making sure that we provide those services to women who are uninsured or underinsured.
Yes, yes. So I'm hoping that the audience is getting a sense of the fact that we have a group of panelists that are boots on the ground, actively in the work. And so as we talked about with the intro, we started off the first series, the first session, talking about contributing factors, right? So what are the factors related to the racial inequities that we see in breast cancer survivorship outcomes? And so tonight we're going to really focus in on the engagement and the work. So how do you partner with Black communities to increase access to rehabilitation, to testing, to navigation, all of those things that we know are going to impact health outcomes? And so Preska, can you start off and kind of tell us a little bit about your life's work and how it's going to contribute to today's conversation?
Thank you again, Lisa. Yeah, actually, I like to say that really today I'll be talking more from the community engagement perspective based on the work that I have done and continue to do. And I usually like to actually say that I believe that my journey into community engagement actually was sparked by my personal experiences growing up in a small village in Southern Africa. And I think out of that, I learned earlier on really the value and the power of community. That if you really desire to accomplish any kind of significant change, it's good to have the community working with you, collaborating with you. That if you have them with you, if they know you and if they trust you, then you are likely going to be able to go somewhere, go further, and be able to have make some, impact some change. And so saying that is like my first job as a PT was actually in a small rural town about 2 hours outside of Chicago. And in that small town, it was just 2 of us PTs in a community hospital. And what I noticed was that in that community, because we got there and being the only 2 PTs who didn't know anything any better, even though, we were only 2 people of color, actually it seemed like in the whole town, but we were able to really kind of immerse ourselves in the community. We didn't have much of immerse ourselves in the community. And in so doing, we connected with them very well in such a manner that when we decided to leave, to move to Chicago, they were so mad. They were so mad and they felt abandoned. And, contrast that to the next job that I then, took or was a part of in Chicago, working in a rehab center that was located in a low income community that served African American and Hispanic clients. This was like a rehab center that was, when we went there, first of all, I was shocked. It was like about 20 some PTs there. But out of those, there were only literally about 3, I think, PTs who were American. All the other PTs who were like the fly-ins from abroad. And and with all of that, anyway, long story short is that being there, it was a great experience. We all were passionate in serving the community and stuff. But the key here was like, we were like flying in and out of that community and going back and forth. And I did recognize the disconnect there. And like I said, as someone who came from a background where I had learned the value of community, it really led me to begin to ask questions related to accessibility of PT services. What, are these services really accessible to the people? And how can we serve people that we are so disconnected from? So anyway, it was that drove me to graduate school, literally. I was just trying to answer that question kind of in some way or some form. And hence, I ended up having, doing my PhD in policy, organization, and management studies. And during that process, actually, I did a fellowship in program evaluation and policy. And that really landed me in working in the community where I provided, capacity building and technical training for community organizations that were serving right there in the community. So I was like hands-on right there. And all of that also began to open my eyes to the power of engaging the community. And that is what has led me to continue on this journey now, even as a PT and now as a faculty member, to continue to draw from some of those experiences and build upon.
Wow. Thank you so much for kind of talking about how you have learned some lessons just from your own experience in different ways of the impact of how we engage with different communities and how that impacts the Therapeutic Alliance. Consuelo, tell us a little bit about your life and your work experience related to community engagement.
Mine's not as interesting as Fesca's. I love it. Well, I come from a completely different perspective. Mine is of a breast cancer survivor. So when I can't say that it's been my life journey to be engaged from a community standpoint, community leader, but definitely when I was along my journey as in breast cancer, I realized that there was such a disconnect. I was one of those individuals who was uninsured. that's the reason why I provide that scope in my foundation. But I was uninsured. I was a single parent with 2 children. And when I was diagnosed with breast cancer, I had a myriad of barriers that I had to deal with. It was access to care, to feeling comfortable, to being able to talk with individuals that looked like me, that can give me some insight to the diagnosis that I had, just the educational piece. And because of that, I didn't have a strong connection with my physicians, and there was just this lack of trust there. I felt like I was very dismissed. When I would go to see the doctor, or when I would ask questions, I felt like I was getting the response as if I was not paying attention, or, she's not as educated, and, just very passive. And that didn't sit well with me, because I am an educated Black woman, but this was something that was completely new to me. It wasn't something that I had a lot of experience with, other than my mother. And my mother, she was diagnosed with triple negative breast cancer, and I was her co-survivor, but I was young, and still and yet there was not a lot of information. The doctors and physicians were not helpful. There were not a lot of resources. So I didn't learn from that experience, and here I was in my own experience. So because of that, I said there has got to be a way to connect women of color with resources and access, and remove these barriers that are hindering us from quality care. And that's when I started Surviving the Odds. So my whole journey into being a community leader and focusing on community engagement, providing those resources and education and awareness to this disease, is simply because of my own experience. So here we are 14 years later, praise be to God. Hey, I'm celebrating my 14th year of survivorship as well. So anyway, here we are 15 years later, actually. And we have established those connections. We have partners in the community. We have partners from the service standpoint, from physicians, and the education is broader now. So we are the resource, even if we're connecting those resources to state information, like the Show Me Healthy Women in the state of Missouri for breast and cervical cancer screenings for women who are uninsured. So we become that liaison and bring the education in regards to that on the Missouri side and on the Kansas side. And we built those relationships so that now that there's trust in the community, so you're no longer apprehensive of dealing with outsiders, if you will, people who come into our community to educate us on how we need to do a better job of our health, or taking care of each other, or seeing the physician. Oftentimes you will have someone come into the community who doesn't look like the community, who wants to express how important it is. And then we don't receive that very well. So now we have an organization like Surviving the Odds, who is that buffer, who says, I look like you, I've been on this same journey, I've been in your same shoes, and we're going to come through this together. So my journey comes from both the personal side and now the professional side. And like I said, not as interesting as Priska's, but that's how I got here.
Oh my goodness, your story was fabulous. And I think, and there's a theme about the trust that Priska talked about, and then you talking about needing to be a trusted messenger and the responsibility that comes with that. And so I am so excited, y'all, to hear Ms. Dorsey's story, because the organization that she represents has an expansive portfolio where they're addressing issues across the lifespan of the Black woman. So tell us a little bit more about your life and your work experience.
Yeah, I'm so glad to be here. And Priska, when you were talking and you mentioned about going to school for public policy, I had a similar story. It's interesting. I moved to Atlanta from New York 20 years ago, had just gotten my master's in public policy. So I was interested in all these macro issues and systems change, which I'm still passionate about. But because of my previous work experience doing educational consulting, and I was helping to evaluate all these school-based and community programs, I really did have this interest about, programs that are happening on the ground. What is happening? What are the barriers in communities? And how can communities work together to solve the solutions within themselves? And so when I got to Atlanta, and a couple of years after arriving at Atlanta, learned about the Center for Black Women's Wellness, and arrived and was struck by this safe space. The first thing I tell people is that I go into this organization, which is a community center just immediately southwest of downtown Atlanta. And I immediately felt like this is a place where I'm supposed to be. And it's not just about what I can provide, but there was something I needed from the Center for Black Women's Wellness. And one of the things, was such a gift to me, because as I had this desire to really look at barriers in communities and how can communities work to fix these pressing issues that disproportionately impact them, there was programming going on in which there were all these community meetings happening. And at the time, this was a long time ago, teen pregnancy was the hot button issue. And you had adults, women and men, who were there and doing these community meetings and talking about how they wanted to help solve these issues. And they wanted to be the ones that were, raising awareness and educated on how to shape these messages around risky behaviors to their young people. So I segue to that to say that community engagement was already embedded in the organization. So that was a gift to me. And then as we evolved as an organization and began to do a lot of other work, we started doing a lot of work around the teen pregnancy, as I said, but then our wellness program really began to expand. So really at our core, our three program areas, one is around ensuring access to affordable quality healthcare for women, regardless of their ability to pay, regardless of their insurance status. Our second piece of work is really around maternal and infant health and making sure that pregnant women are linked to prenatal care and that we're reducing the issues of infant and maternal mortality that impact Black women. Then our third work is really around economic health and financial literacy and micro-business training to make sure that women, poverty is not a barrier to accessing care and ensuring a good, high quality of life. So in that, in all this work that's integrated, that's really about how do we improve the health and well-being of Black women in a holistic way, in a comprehensive way, in a way that makes sense to them. And so they have to be the designers, they have to be the solution solvers, and they need to be lifted up. And so one of the things that I've learned over the years, that it's not about what we can do for the community, it's not about what we're doing to the community, it is what are we doing with community? How are we learning from each other? I am not the person teaching you anything, you're teaching me. We should all be looking for nuggets each and every day from all walks of life, from everyone. I know that that's why we're all here today, to learn from each other. And so that is, how I walk into this space, with humility, knowing that we don't always get it right, acknowledging that sometimes there's unintentional harm caused in communities, caused to Black women, and how do we say, I messed up, let's repeat, reset. But how do we have the humility to do that? And how do we trust Black women that they know what they need, and that we are partners in helping to identify solutions and help them along the way. And that's with survivorship and so many other areas of life.
Oh my goodness, it took everything in my spirit. I was like, be still, don't do a hallelujah dance, be still. I'm like, almost, I feel like we could just drop the mic, walk off there, put that on a t-shirt. That is the core tenet, is that you are partnering, right? These are not subjects. You are coming in and interacting with another human. So thank you so much for that. So we're going to ask some questions specific to your organizations and your past history, so that you might be able to sprinkle some pearls of wisdom to our attendees about some of the things that you've done to be able to move forward with community engagement. And so, Consuelo, I know that you are a graduate of the Hurl Freeman Patient Navigation Institute. Can you talk about how that skill has aided you in helping to improve cancer survivorship outcomes for Black women?
Yes, absolutely. So the biggest thing about that is understanding patient navigation. That was a new term for me when I actually attended the Harold P. Freeman Patient Navigation Institute in New York. It's one thing to engage the community and impress upon them the importance. It's another thing to actually connect with the community and give them information to help them make informed decisions. And it's meeting them where they are. It's meeting each and every one of us where we are in our situations And I had learned through that there was an educational piece around breast cancer that is a story that should be shared. When Harold talked about, the statistics of death in New York at a time where they weren't even accepting patients who didn't have insurance, were pretty much left to their own devices. And because of his work, turning that statistic around for more survivors, that's the story we need to share, because that talks to being proactive. That talks to, instead of being, and oftentimes we find in the Black community that we are reactive to our health disparities as opposed to looking for the resources, seeking the education. But also it taught me to understand that I got to give statistical information that is real for us. I learned that when I would often hear the 1 in 8 diagnosed with breast cancer, that's not necessarily for people of color. But we have to share that information and be precise in saying it affects us, it impacts us quite differently. Their story is not our story. Our story is different. Our diagnosis is different. Our outcomes are different. Our education around this is much different. And we need to be more mindful of that and like you said, sprinkle those pearls of wisdom into the community so that they can feel trusted, or we can be trusted by them to make an informed decision to do the right thing. So I learned a lot at the Harold P. Freeman, and that was the biggest thing. My biggest takeaway was just being able to share the information, accurate information as it pertains to us. Women of color, when I talk about women of color, Black and Latin, I always focus on triple negative breast cancer and how that has impacted us, and how when I talk about it, it's almost saddened to see there's not a lot of women who even know what that is. Women of color, they don't even know what it is, let alone how it impacts us, how it's wiping us out in big numbers, how we have, more diagnosis at early ages. So that's the information that is really critical when you're talking about sharing it to someone who can make an informed decision to be more proactive as opposed to being reactive.
Thank you so much. And I'm going to piggyback on that a little bit, because you talked about how that we do see breast cancer in these marginalized communities at a much earlier age and at a more advanced stage. Can you talk just briefly about the work that you've done in regards to screening activities and how you have made it something awesome, almost fun, where people are like, wait a minute, how do I sign up for this?
Yeah. So because I realized we like to do things in a fun manner, and we have to eliminate the fear, and we have to build trust and bridge the gap. How do we do that? So what we did here in Kansas City is we started mammogram parties. And one reason was to eliminate the barrier of transportation, barrier of finance, barrier of insurance, and take the women to the service. So we would get a party bus, we would load up about 35 to 40 women and take them to our imaging partner, and we'll spend an entire Saturday, and it would be an actual party. We would have all free screenings, we would have food, we would have other health services, but this would be an opportunity for us. It was an opportunity to really talk to the women and educate the women on breast cancer, knowing where your resources are, because we're a resource, but there's all other resources that they weren't even aware of, that most women aren't aware of, like I spoke of earlier with the national breast cancer and cervical screenings for each state. Every state has that, but everyone doesn't know about that. So that was our way of getting in the community and taking the women to the service, and then following up with that continuum of care. And we've had that every year ongoing. So if you were to go to our website, you can sign up to just get registered for a mammogram, or you can sign up to book a mammogram party. And that's been the most effective way, because we find that sisters like to come together and do things in a sisterly fashion.
Yes. So thank you so much for talking about that. And so Prescott, as we're talking about opportunities in which we can partner with the community, what would be your advice to rehabilitation providers? What are the lessons that you've learned, and how we might build better community with cancer survivors and their caregivers to address outcomes?
Oh my goodness. I think I would like to say, first of all, one of the things that came to mind as I was even listening to Consuela and even with Jamia was just the fact that, for example, when Consuela talked about, people not getting, not wanting to get information, or you want, if you give information, people, like Black women will choose who they want to get information from, something along those lines. I'm probably not phrasing it appropriately. But out of that, what that kind of really reminded me in terms of us rehabilitation professionals, my role really, my approach now at this stage with community engagement and all of this, I think now I'm doing it more from the educational perspective of educating our students and equipping them, since they are the future PTs. And my job is to take them into the community and educate them and expose them to even like these resources that are out there. What is out there? Number one, and just to speak quickly to that, in the sense that, for example, when we work with our students, we work with single moms, and also with like family support systems. It was just amazing, because I tell them that when you see a mom or a family and you evaluate them and you treat them in physical therapy, you need to be able to also know what's in their community, to be able to refer them to resources that are out there. So it was just amazing when the students actually find out about some of these resources, like Consuela mentioned, some stuff that's available in every state, like even like, and I always give this example of like, when the expression of our students' faces when they found out about this database called Aunt Bertha. And they found out that, oh, you can go to Aunt Bertha and find out all these things. Like if you have a mom who needs daycare or needs all of that, you can go find all of these things. I think sometimes as PT, as rehab professionals, because we're so in our cocoons, in our clinics, where we come in and go back, to our places, and we don't, like we say, we don't live in those communities and stuff. We don't have that information. And so we are ill-equipped to even equip our patients. So that's one of the things there that I would say I do. And then the other thing too, as rehab professionals, especially when I'll think about even like dealing with something like breast cancer, when anyone is dealing with an illness like that is, threatening their very life, they do need, that environment that is very supportive, and they need someone who's willing to listen to them and talk to them. So one of the things that honestly that I'm really, passionate about, and that I believe that we are slowly kind of beginning to embrace, is moving away as PTs from what we call the paternalistic approach to care, and embracing shared decision-making. I know when I worked in the Chicago area and, I, intermingled a lot with people in the public health arena, that was like something that was talked about a lot and driven a lot. But really, when you get within the PT community, that concept of shared decision-making is absent. We are so clothed with this hat of, I'm the expert, I'm the PT, and they're coming to me, I've got to tell them this, I've got to do this. But we really, our code of ethics, if you actually read it, it really, really is pro-shared decision-making, where you really, are to listen and, work with the individual collaboratively to make that decision. So that's one of the things too that I, as part of all of that. And also, like, as we go, one of the things too with rehab professionals, as we are working in the process, is redefining what we mean by access. We keep thinking, oh yeah, we have clinics everywhere. These patients can come, they can go to the clinics, but we forget that access has multiple dimensions. And I think from even the talk from Jamia and from Consuela, you could hear some of those elements being mentioned. Number one, there's a study that was done out of Canada that talked about the 5 dimensions of access. One is approachability. approachability, and that includes, elements like, when people even think about your clinic, what comes to mind, how culturally relevant is your, appropriate is your clinic and stuff like that. So information, the kind of information that you are even using to advertise your clinic might actually be what's keeping people away. And then you have the next dimension is acceptability. How acceptable, are the services that you are delivering to a diverse, community of people. And then obviously we then begin to talk about availability and accommodation. Are you taking into consideration where are you located? I mean, you're expecting people to jump out and come out there and stuff like that. So, and then the other one of affordability and then appropriateness. So saying to PTs, let's get, as rehab professionals, if we can get out of that one lane thought process and begin to really open our minds. And a lot of this really comes when we go out and begin to educate ourselves about the communities that we serve, or the communities that need our services, and open our eyes. And part of that comes from immersing yourself in the community. And I'm going to say one last thing, which is like about one of the things that also has become very popular with PT now, with rehab, obviously, are the pro bono clinics. And we think, because we are offering pro bono services, we are addressing the situation. But that's the whole other,
that almost needs to be a whole separate webinar about the fact of that pro bono services definitely have a role. We need those, but it does not change the system and the structure, especially if we are not reporting back the economics around the delivery of pro bono services, right?
Exactly.
There's nothing free in America.
Yes.
But Preska, before I leave you, I just want to make sure, because that list was powerful. Can you just, and it's a good list for everybody. Anytime you think about an intercultural exchange with someone, be it for services, be it just for any assets. So what were those items again?
Oh, you mean accessibility, the dimensions of access?
Yes.
Approachability, acceptability, availability and accommodation, affordability, and appropriateness.
Okay, the 5 A's, we got it right there. So yes, so Jamia, tell us a little bit also about kind of what is it we can learn from your organization in regards to when we're at that place where we're ready to partner with the community. What are your words of wisdom?
Yeah, well, first and foremost, I just want to say, Consuelo, I love the idea. I love the notion of the parties. So that, so with that being said, I mean, I think that it is really about those opportunities, the innovation, and then looking at these 5 A's, which are, thank you so much for that, because I wrote those all down too, because I think that at the end of the day, when we talk about community engagement, we have not approached it within thinking about a framework in that way, but that is, we're very intentional about that. So just similar to what Consuelo said, when we, as a clinic, we do the clinical breast exam, so we partner with entities that are bringing mobile units so that we are doing mobile mammography services. And that goes into the accessibility. So I think when we think about partnering with communities, we're thinking about the issues of accessibility. We're thinking about the issues of course, making sure that for us, it's very important that we have staff that also share very similar lived experience. So we have our nurse practitioners, but we also have a breast health advocate who is a woman from that very community who works in tandem with the nurse practitioners to basically make sure once that, she is the one that is making those phone calls, the reminder calls. Once a woman, needs linkages to diagnostic services, she is working very closely with the nurse practitioner. And she really is the one that has connected very organically to our survivors. And we don't have a formal survivor program, but it is all about relationships. So it's very relational. And so the work that we do with our survivors is really around them thinking about, oh, what are some things, fun things that you would like to do together? So we've done things like sip and paint. I mean, we've done all kinds of things that have been, again, it has been organic. It has been, but just fun stuff, like the notion of the party, because, coming together, and so that has been vital. So I think that when it comes to working in the community and working with community organizations, we all want to, first and foremost, I think it's so important that we all know who we are, right? Because, I think about our work and I'm like, we need, PT, we need to be linked up with folks who are doing work in that the survivor space. And so I think that it's important that we all come together. There's so many opportunities for us all to increase our awareness of, what is out there, for us to help, build trust using staff, again, with lived experience, so that we really do have these very diverse workforces when we're talking about what does it look like in terms of, from the standpoint of screenings to survivorship. So I think there are a lot of great opportunities. The last thing I will say, I talked about the mobile services, but we also do make sure that in terms of if women cannot go to the mobile unit, we provide support for transportation for them to actually go to wherever the places where they're getting either screening or diagnostic or treatment. And so, we want to be very mindful of all of those barriers, so that knowing that we cannot all do it alone, that we need each other. And that's why the partnerships are so important, because what we can't do, someone else can do, and we need to know each other so that we could be living in that same space and we're all working together to ensure equity for Black women.
Thank you so much. Thank you so much for reminding us about the need to collaborate so that we can provide the highest quality services, instead of, a lot of times in our fragmented, decentralized models, everybody's doing a little bit of something where we could do something really great together. And I love this conversation about, trust, that ultimately we're wanting to build trust, but then that also means that we have to prove ourselves to be trustworthy. And so there's a whole body of research related to relational capacity. And so for the audience, that's something you can Google, is relational capacity. And they talk about the competences associated with that. And so we've talked a lot about your experiences and the good work that your organizations are doing. But, we got to make it tangible for the people. And so, and often people just see the greatness, right? They see the goodness at the middle and the end of the journey. So we're going to take it all the way back, right? So we're going to take it back to that first step. So for someone who is interested in building relationships with community and shared decision-making and community-based initiatives, what is the first step? So Consuelo, what was your first step in the development of Surviving the Odds?
Well, for me, it was just the whole educational piece for myself. Then secondly, it was the educational piece around who in this area can be a service provider, or who in this area has a link to the community that I am serving. And I found, it really was our church communities. So when I'm talking about getting into a community and delivering the message to a mass number of people about the services that we want to provide, about the education that we have, and I wanted to find out how can I be most effective in that way. That's what I did. So the first step for me was just understanding the playing field and knowing who the players were. And then I was very intentional about making the connection and letting them know that what I am doing is for the betterment of women of color. And I made that clear, because not all partners want to partner with you if it's not serving them in some beneficial way. Let's just be real about it. So I always made it very clear what my mission was, what my focus, where my focus lied, and what community I was serving.
Come on, where the truth reside.
Yeah, exactly.
So Ms. Dorsey, what would you recommend as the first steps?
Yeah, I agree in terms of really looking at the landscape, seeing who the players are, what resources are available, what partners are available, what do women want? You know, starting with that, really, because that's a whole environmental scan, community needs assessment. But you know, you got to start with what is it that women want? What are the barriers? Stop making assumptions. And so, and we all make assumptions, you know, because it's not just fear is one thing. It's not just fear. It's not just lack of insurance. It's not just, you know, like there are other there. So I think that we have to be willing to unpeel the onion and see all the layers. And the other thing I want to just lift up is that community building and community engagement takes time. And oftentimes we are looking for the quick fix. We've got to serve a certain number of folks. We've got to do this. We want to do that. And there, you cannot speed up the development of trust. You can't. And so it's just, it's impossible. In a lot of our work, we've learned that we can't even start with where we want to go. We learned this a lot in our work around maternal health. Like, you know, we were talking infant mortality, and that just didn't resonate with folks. And so we had to start talking about things that interested, that the community wanted to talk about. And then we kind of ran, you know, so we looked at it as family well-being or family, you know, and people came to the table when we broadened the message. And so you'll be surprised that a lot of, and so we cannot come with the assumptions. And that's an example of being very transparent of assumptions that we had. This matters to us. Doesn't it matter to all of you all, you know? And it's like, well, the broader message is what mattered. And when you cast the wider net, then you're able to create these alliances that are that are broader and deeper and often more meaningful. But, you know, I cannot just state this enough that it takes time and it takes commitment and it takes humility. And if you don't invest the time, you likely will not get the results, and you won't get the trust, and you won't get the long-standing and sustainable partnership with community.
Thank you so much for speaking on that. And I'm going to ask you one more question, Jamie. So when you have come into a project with assumptions, right? Because a lot of times we build these projects and research projects based on our hypothesis, then how do you explain to a funder that we've got to change this a little bit because we need a little more time, or this isn't really what the community wanted? Can you talk a little bit about that?
Sure. You know, I have found oftentimes, you know, communication is so important. Oftentimes I think that and I'm speaking for myself too, you know, where we often may err is that we're only communicating at the time that a report is due or there's some sort of that kind of, you know, and I have found, especially over the past couple of years, that funders really, there's a strong desire to really hear what's going on the ground in real time. Often we're stretched to capacity. We don't even think to do it, but it is often helpful just to say, hey, you know, this is some of the things that we've observed. You know, we're thinking about doing a different approach. And we've heard from women that they would rather X rather than Y. And I think that it is in everyone's interest for us to just kind of step back and reassess before moving forward. So I think that is very important. And I have found, especially during the COVID climate, where funders have even more of an interest to know really what's happening on the ground because of COVID and how that's impacted our programming. And they appreciate the transparency and the honesty. And I think we owe that to Black women, that we can't just, like, we have to be willing to change course because the stakes are too high to not. And so I think that, you know, so that is just my feedback on that. But I think it's important to say, you know, we're a bit delayed because of this, but, you know, we're reassessing, and based on what the community has said, we're going to do this very differently.
Thank you for saying that. Thank you for saying that out loud into the space that we owe it to Black women to be their advocate and champion for. Thank you so much for saying that. Prescott, what's your thoughts?
I think I would echo what Jamia and Consuela have already said. And I'll just also start with just the fact that, number one, if you're going to be in the community, I'll say just be honest with yourself and do some really serious critical self-reflection. You really want to know yourself when you go in there, and because pretty much I feel like in the community, I'm the instrument, that's actually doing everything. And so if I don't really take time to be in touch with myself and kind of know my triggers and all that kind of things, then I'm gonna cause some ruffle feathers there and cause more harm than good. So that's one of the things. And then number two, echoing what Jamia and Consuelo already said, know the gatekeepers in the community. For example, when we moved to Lakeland, where we are here now to start this DPT program, and because we knew that our program is hallmark was going to be community engagement, we literally got here and scouted the land and really, began to find out like who are the key people, who are the key stakeholders and stuff like that. And by doing that, we were able to, like, now pretty much it's like we created like a foundational kind of, I don't know what to call it. We kind of have that solid thing that now, like, anytime we need to do something, we know, where to do, and we got all these people that we can reach out to and stuff like that. So doing that definitely, does take some time to do that, getting to know those gatekeepers and kind of build rapport with them and show them that, you are really here to be side by side with them. And then the next thing then is like, then depending on the population that you are trying to serve, my suggestion with that is, just like Jamia said, take time to know them. For example, with the organization that serves the single moms, I literally spent the first, I would say, semester or so. Obviously, like I said, it's time consuming. And I know if there are any educators there, they'll be like, well, we don't have that time. And I totally agree and I understand. But, shortcuts, I challenge on their own. But anyway, we spend time, I literally spent time in that community, in that going in, meeting with the moms, talking with them, getting to build rapport with them. And out of that, now we have such a relationship that continues to do, even when some of the things we are no longer able to do them the way we used to do them. It's like, there's an understanding and we do that. And I think that's really spending time in there. And that's another thing too that I noticed even in graduate school, when the university that I served with, they were trying to go in the community and into these housing projects to set up some clinics. And I was the graduate student volunteer in the task force, and I was the one who was in there. I literally spent time in those housing projects. Sometimes I would even just be sitting there and just talking to people and just getting to know the people and stuff. That was the groundwork that was needed to lay, in order to lay the foundation to put those clinics in there. So that's definitely one. And then in that process, when you are doing that, keep an eye for the strengths of the community. I know most often when we go in, we are looking for the weaknesses, like the things that we are trying to fix. No, go in with an asset-based mindset, looking for the strengths, because those are the strengths that you can then tap on to actually, help get what you want to work together in, get going. So that's the next thing that I would say. And then also to echo what my co-panelists have already said, go there with a sustainability mindset. Because if you are not planning to be there for the long haul, if you are not willing to stand the challenges and stay there, it's not, just stay out. And like I said, one of the things that we learned was like when I was a graduate student and I went out to do these things, one of the reasons why I was in there and spending all this time was because, the health system had been in that community before, and then abandon them. And so they did not want to hear anything. It didn't matter whether you were trying to come and put a free clinic in their neighborhood. The trust was broken. So that's why I say, if you are not willing to go in there for the long haul, rethink and maybe find another way. I mean, you can find other things to do to still serve, but those are the things that I would emphasize.
Thank you so much, Dr. Collins. And yeah, I agree with you, Consuelo. That was amazing. And as you noticed, Dr. Collins speaks with grace and a lot of inclusiveness, like she wants to draw you into the conversation. I don't know how many of y'all remember the skits with President Obama and the comedian that was the rowdy interpreter. So I'm gonna give you the rowdy interpretation of what Dr. Collins just said. If you come in to colonize, if you come in and you don't have enough time, if you come in and you don't want to listen to the community, then you're probably not the person, not the organization, and you probably ain't needed, right? And I said ain't, yes, I did, right? Because the goal is to not don't bring more trauma into communities. It would almost be better for you not to show up. Show up knowing that you are a guest. And if you don't know what that means, then watch Wakanda, watch Black Panther, but know that sometimes you are a guest in these conversations. And it doesn't matter what your race or your gender is, you're coming into that community to ask the community what they need and how you can partner with them. So that was the rowdy interpretation of that. All right, so y'all, here's the last question before we get into the Q&A. Because the data suggests that African-American or Black women are the most, have attained more educational success than any other racial, ethnic, even sex, gender identifying group, right? But we also recognize the fact that we do not see the relationship between education and health for Black women as we see for other groups, right? And so if you were to think about what are the local national resources buy-ins that would be needed to really move forward to make some significant progress in the health outcomes for Black women, what would those be? And Jamia, we're going to start with you.
That's a good question, Lisa. You say the national organizations. We're a local organization, so we don't deal with too many national organizations. What I'm struck by is our need to, as good of a job as I think we do with partnerships and collaboration, I realize that I don't think you can ever have enough. Like you can never, there are so many untapped resources and opportunities. And so this whole panel, it just has me thinking about all the additional connections that we need to make around specific for cancer survivors, and so that is something that just keeps resonating with me, and it's a challenge and it's an opportunity, and I look forward to working my staff working on that. And I think that in terms of your conversation about and your question really around this education, Black women being as highly educated as we may be, it's not a protective factor for us, in terms of, any of the tragic disparities and so I think that it is going to take really an integrated approach and going beyond just thinking about the traditional cancer organizations. We have to look at all other kinds of institutions and other players that we may not have thought of before to have a truly holistic approach, because we don't just come as coming as a, because of my own health issue, or I'm coming because of this. We come as an entire person. So with all of that and all these issues and the intersection, right, between, systemic racism, so we've got these issues of, racial justice, we've got health, we've got economics, we've got, all these issues. And so I do think we need to have this broad network to think about how if we're really going to talk about equity and what that looks like, we need to be thinking about some non-traditional players. And so you raise a good question. I don't have specific national organizations that come to mind that we need to align ourselves with, but I think it's a fascinating question. And I think that we need to have a broader discussions about that and what that looks like to truly improve the health and well-being of Black women.
Thank you so much. Consuelo, what's your thoughts on that?
I certainly echo Jamia, and I think about it in the same manner our federal government pulled funds together, our local communities pulled funds together during this pandemic. You know, we should strive just as earnestly to ensure that a sustainable financial resource to support our community organizers, our community navigators, our nonprofit organizations, our healthcare providers, and especially those who focus on the disproportionately communities. So I think about Kansas City. It was real interesting during the pandemic. We created the Community Development Fund. Now, if we could come together to create a fund like that that supported all of those organizations, and the primary focus was on minority, women-owned Black businesses and nonprofits. So the first round, I think we collected something like $500 million. Imagine that. So you're thinking about all the banks, all the big major corporations in Kansas City said, we got to do something, and you come together to do it. So why can't we have that broad discussion about doing something for something that's just as important? When you think about healthcare, the equity in healthcare, lack of access, and we know it's a problem. We know it's a problem for people of color, Black and brown communities. How come we can't have that broader discussion? We need to have that broad discussion because we know we're capable of doing it. Like Jamie has said, there's not something on a national level that I'm really familiar with, but I know what we're capable of doing here just within our own region because we've done it and we express the importance in doing it. And when we think about improving diversity, equity, and inclusion and creating inclusive prosperity for all, that's the conversation that needs to be brought to the table. How do we include access to care and how it affects people of color more specifically and be more intentional about it?
I love that. Thank you so much. And Dr. Collins, what are your thoughts?
Fine. Oh, I got it.
You see Bill's question?
Okay, I'm popping in, Lisa. I told you I would.
Yes, we're gonna real quickly just let Dr. Collins finish up with her thoughts.
Absolutely.
So yeah, go ahead, Dr. Collins.
You know what? I was gonna say I don't specifically have a resource in mind to like where you can go to find all this information, but I would just think of like, you know, just going to websites too of like some of the organizations that fund a lot of like health disparities work, and even like at least for rehab professionals, I'd say like even, you know, I know some, you know, there are a lot of rehab, or no, let me not say lots, I'm exaggerating. I say, you know, a lot of people that I've talked to, they're not even aware of, like, for example, the Office of Minority Health.
Yes.
That you can actually go there and find a lot of like resources along with that. And then, for example, also the Robert Wood Johnson Foundation, I know they they fund a lot of stuff related to health disparities and stuff, and they do write a lot of stuff on social determinants of health and stuff like that. I don't know if they have a list of like resources and things like that, but I know there's a treasure trove of things in there on their website. And then the last comment I would say also, please, let's not forget in all this dialogue too, especially talking about, you know, cancer survivors within the Black community, let's not forget the church. I think that's one area that we should never leave behind, in the sense that also not only is it an asset, but sometimes also it is a place where, you know, people actually get, you know, misinformed. So that's another place that I think, like, even as health professionals, as rehab people, you know, in this area, we could visit churches and talk and give like wellness talks and things like that. That could be a very helpful.
Thank you so much. Thank you for talking about the faith-based organizations. Thank you for talking about Robert Wood Johnson Foundation. I think, everyone needs to know what their county health rankings are. You talked about the offices of minority health, which are located in close proximity to all of us. So you want to get out and Google those. There's a really great organization called Health Leads, LEADS, that has a lot of resources and will also partner with you, because a lot of times we focus on the downstream factors, right? The things that need to be addressed right now, just so that people can survive. But ultimately, we've got to get upstream of this and create some structures and systems so that we're not even having this conversation. So the vision is one day we will not have this conversation, but this has been a great conversation. And so Jill, we are ready to hear the questions so that we can interact with the attendees a little bit.
Okay, great. This has been amazing. Some of the Q&A is just how amazing it is. So kudos. This has been a great conversation, very energetic and very lively and very helpful. First of all, everyone, there was a lot of questions about the 5 A's. Priska had shared that with me ahead of time, so I posted the link to the paper in the chat so people can actually get it. It's open access, so it has the 5 A's there. We do have a question about that though. As a researcher, how should we think about applying the 5A or the dimension of the 5 A's to demonstrate trust and commitment to potential research participants, particularly if the goal is to make sure that we're including Black breast cancer survivors in our research initiatives? Priska, do you want to, Dr. Collins, would you like to take that one? Thinking about the research application.
Yes. Number one, I would say if the research applications, and the simplest one, which, for example, like what I've used that framework actually when I enter a community and really going through all of that, just looking at all those 5 A's and seeing that what I'm trying to do and where I'm going, where does it fit in all of that? So like that's, I use it more like as a planning tool. And then I also use it as an evaluative tool. So, evaluating our processes while we are going. So that's the simple way. And in that sense, pretty much like in that way, you can actually generate a lot of data just from using it, as a way, for, your entry into the community, and also for, for the planning process, and then also for the process evaluation and stuff. So I would say that's one simple way as a researcher. And then the other thing that the other avenue too that I would say in terms of the 5 A's, I know for us too, we have used it when we were looking at we did a paper on accessibility for hand therapists. And when we're doing that, if you are one of the things, like right now we're working on a paper where we're looking at, we were looking at accessibility of outpatient PT services in the Chicago area. And pretty much we're looking at that, yes, location, and then we did the, focus groups to find out what people actually think about it and things like that. So you can use it also to generate questions about what is available in your neighborhood. I think that might also be said. What is available in there? And really, is it available? Because maybe we think it's available, but it's not really available. So you can use it that way. And that's kind of like how we, at least, we have kind of used it back and forth. And honestly, as a continuous guide and evaluative self-evaluation tool.
Yes. And I'm just going to jump in there real quick too and say, it's a great framework to start the conversations, right?
Yes.
Because I think that's one of the things that we heard from all the panelists is you've got to build community. And that may be the framework to use by talking with community members, influencers about what does each of those words mean. because that community targeted, tailored language is going to be one of the things that is going to determine the sustainability of your projects, right? Because words are all about agreement. And so that would be a great framework to use to start that conversation.
Thank you. There were several questions related to the mammogram party. So I'll direct this to Consuelo. That it sounds great. Could you comment on how you provide follow-up or suggest follow-up based on mammogram findings? And another question about just sort of comment on fun and reliable follow-up. So let's put those two together. So it needs to be fun, reliable, and follow-up. That's not a tough job.
First and foremost, it's absolutely fun. That's the one thing I've learned. If I really want to reel people into doing something that they think they don't want to do, but I really need them to do it, you got to make it fun. But it is a serious matter, of course. And our partners, we rely on imaging centers to provide us the free service. But the one thing we don't rely on them to do is provide continuum of care. So we follow each and every one of our patients. And we do have access to their information. So the one great thing about part of that service is if they don't have a doctor, we connect them to the doctors. So no patient is ever dropped. They are connected through the imaging center, our system, and definitely through the physician who is reading their screenings. And we follow with them every year, as will the imaging center. You know, once you get locked into someone's system, they're going to follow up on you, but we don't rely on that. That's one of the great things about our organization. We make sure to follow that patient through continuum of care. And I think that goes along with building the trust, because if you have a woman of color who has never had a mammogram, or this is her first mammogram, or she had a bad experience and said, I'm never doing it again, but she chose to do it with us through our party, then you're building that relationship, and you know that she's going to come back year after year because of that great experience, not only getting the service, but also being educated and getting resources to other services that she may qualify for if she's uninsured. And when we say free, when you tell us women of color is free, it better be free. So, and we understand that too. So we don't drop the ball financially. We make sure that everything we provide is absolutely free for these women. So if you want, Jamie, I want to come to Atlanta and do one with you. I want you to know that I want to come there and do one with you. So when you think about innovative ways,
I love that.
Ladies, let's talk offline. I would love. I've done it in 4 other cities, and it's been amazing.
Somehow Turning Point wants to be at that party, so we'll be there too. So.
Absolutely, I forgot you're there. Absolutely.
Another question, and anyone can answer this, and maybe just a short, quick question, a short, quick answer, sort of a lightning answer. How does your organization or your programs approach advertising or promoting that you're approachable? Because people don't know you're approachable until they're there. Any suggestions to specifically get that word out that, yeah, we are approachable, our program is?
I'll go first. I think one of the biggest things that we do is we are in the community. So if it's visual marketing, if it's video marketing, we show that connection to everyone we serve. We are the community. And you know, when people see that vision of you just engaging and you appear to be approachable, and you are approachable, and you're sharing thoughts and experiences and love. I mean, your emotions, sometimes when you're dealing with cancer and you're dealing with people who have not had access to care, and they're finally having an opportunity to do something with an organization or get the service that they've needed for so long, emotions spill out. And that's captured in so many ways. Like I say, it could be a picture, it could be a video, but that's some of the marketing that we do intentionally. It's not about being up here and talking about, you know, using language that everyone's not accustomed to hearing on a daily. It's about being in the community, being the community. And that's how we approach it. We are part of this community.
I think for us, the way people find out that we're approachable is generally through someone else who's already been benefited from our services and has said their approach, you know what I mean? Like, so I think it's that trusted person who says, I've been here and I can vouch for them. But, you know, of course, advertising is great. We do a lot of social media and things like that. I know people who do, who are doing a lot of like videos. So they're trying to, you know, provide some health education content so people can kind of see them and sense of, you know, whether or not they're approachable. So they're kind of different ways to kind of get some information out there so people can kind of touch and feel you while not literally touching and feeling you. But I do feel like, you know, some of the best ways is really the word of mouth. Folks being able to vouch for you, that you're authentic and that you're and that you know, you're there to help.
Totally agree with that. I totally agree with that. And also like just putting down titles, I mean, putting down your titles, I mean, having nothing to do with that. I remember an incident just a few weeks ago. Someone came looking for us at the, you know, looking for me at the mom's place. And they were like, we're looking for Dr. Collins. And the lady was like, we don't know her. And then I was like, and then she's like, oh, well, we just call her Priska. We just know her as Priska. Oh, so, you know, it's stuff like that too. You know, trying to minimize a lot of those things that kind of tend to connote hierarchy and all that stuff.
And I would agree that the partnering is key. When we were doing our project in Arkansas, where we were going around the state talking with cancer survivors and their co-survivors about unmet needs, we saw night and day. So if we just did the marketing, we might have 2 or 3 people trickle in. But when we partnered with someone from the community, an influencer that also was part of developing that marketing, it was totally different. We'd have 20, 30 people show up. So it's really important to partner with the community on these activities, because sometimes we undervalue just how important that trusted messenger is.
Yep.
Thank you. We have quite a few more questions, but it's 8:25, and unfortunately we do need to wrap up. A couple of people have asked about contact information. The contact information for all of our panelists tonight and myself is they're in the slides, and the actual video recording for tonight will be on our website. So it is easy to find us. If the panelists want to add it to the chat, that would be great, but they are also on the PowerPoint, so they are available. And I apologize for not getting to everyone's questions, but you can reach out to us. In a couple of moments, we'll be sharing some slides that have my email, and I'm happy for you to reach out and can pass questions on as well if that's easier. So at this point, we're going to share some slides again. Before we do, I just want to thank all of our panelists, and we'll do that formally, but while you're still here and we can see you, this has been an amazing conversation. So helpful to all of us. It is empowering, exciting, energizing for all of us working in the breast cancer survivorship field, and particularly helpful for those of us who are trying to work alongside communities and know that we need to and want to. Your tips and your treasures and your wisdom was so helpful. Thank you very much. So Matt, can we have the PowerPoint, please? And if you can leave your screens on, panelists, or you can turn them off, your choice. So I want to again just thank everyone for being with us tonight, particularly our panelists and Dr. Van Hoos, our moderator. The conversation is not over. We're just beginning it. This is the second of 4 in our series. Next slide. Our next forum, we have a date. We're going to move from community solutions and engagement to national strategies for enacting change, not forgetting the community-based solutions, but really looking at then how do we meld together community-based activities with national initiatives so that the community-based activities are going on across the United States and not just in certain local areas. It's Wednesday, April 24th, the same time, Eastern time. There's an email address if people want to reach Turning Point. It's bcsurvivorship@myturningpoint.org. Next slide. We have a group of champions for change that's growing. We're thrilled. They have agreed to walk alongside Turning Point for this initiative, and we're thrilled to have them with us. They have helped us plan these forums and check into the forums and are helping with the initiative as a whole. So thank you to them. Next slide. And our panelists and moderator, amazing. Can't say enough good things. Next slide. And thank you to our sponsors. These sponsors have helped us put this second forum on and are partnering with us throughout the series of 4 forums. And any of their sponsorship dollars that comes to Turning Point goes directly to support our initiatives on outreach to the Black community, as well as providing direct care for women of color at Turning Point who are going through breast cancer. Next slide. And these are our partners who have graciously, again, walked alongside us to get the word out about our forums. We deeply appreciate them. And finally, some contact information for Marilyn Pink is mpink@myturningpoint.org. I am jbinkley@myturningpoint.org. And then our generic breast cancer BC survivorship. We would really like you to please fill out a survey. We need this for funding. We need this to make every forum as excellent as it possibly can be by giving your feedback. Right after we end the webinar, you will get a link to the survey. It only takes a couple of minutes to fill out. We'd really appreciate you doing it. You'll also get a reminder email tomorrow morning. So thank you very much. And thank you again to our panelists and Lisa. Take care and have a good rest of your evening. Bye.
Thank you.
Okay.